The number one question men ask me on social media is always the same. Doc, is there really a safe way to get bigger, more length, more girth? And I understand why. For most men, this isn't about vanity, it's about confidence, intimacy, and feeling like yourself again. So today, I'm finally going to break it all down. Not myths, not gimmicks, but the real medical truth behind penile lengthening. What actually works, what doesn't, and what you should never waste your time or money on. I'm Dr. Ava, a urologist, and someone who's spent years treating men's health concerns both in the clinic and in the operating room. My mission is simple: to give you clear, honest, medically accurate guidance about your body and your sexual health. If you find videos like this helpful, make sure you subscribe. I drop new, evidence-based content every single day to help you stay confident, informed, and in control. Now, before we get into solutions, we need to talk about the real problem behind all these questions about length, size, and girth, because the numbers tell a very different story from the fear men carry. There was a massive survey, over 50,000 heterosexual men, and more than 55% of them said they were unhappy with how their penis looked. But here's the twist. When they asked those men's partners, 85% of women said they were perfectly satisfied with their partner's size. So the disconnect isn't between men and their partners. It's between men and themselves. And a huge reason for that is the world we live in today. Pornography has completely distorted what normal looks like, and many men are comparing themselves to bodies that are not representative of real life. The actual science is clear. The average erect penile length is about 5.2 inches, or 13.2 centimeters. Anything within 2.5 standard deviations from that, longer or shorter, is considered normal. To put it in perspective, a truly medically short penis, something below 2.9 inches, 7.5 centimeters, is classified as micropenis, and it occurs in just 0.14% of the population, less than 1%. So the overwhelming majority of men worried about their size actually fall completely within the normal range. But that doesn't make their feelings any less real. Because for many men, the issue isn't the measurement, it's the mental weight they carry. There's even a name for it: small penis anxiety. It's a form of body dysmorphia where a man becomes preoccupied with the idea that he's not big enough, even when he is. And this isn't just insecurity. In severe cases, men can spend hours every day thinking about their size. It can affect their relationships, their work, their confidence, even their mental health. Some men become so distressed that they end up in the hospital or struggle with suicidal thoughts. This isn't a joke. This isn't vanity. This is a real men's health issue, and it deserves to be talked about openly, honestly, and without shame. And that's exactly why we're diving into it today. Here's the other big problem with this topic. The moment a man Googles, "How do I get longer?" he's flooded with websites, ads, and treatments that look convincing, but are often unsafe, unregulated, or flat out dangerous. Many men even travel abroad or visit non-licensed providers, and the consequences can be life-changing in the worst way. Please don't do that. If you ever consider any treatment, your first stop should always be a reputable urologist or psychologist who understands men's sexual health. And before we go further, you need to know this. The Sexual Medicine Society of North America does not recommend penile lengthening or girth enhancement for the average man. These procedures are considered experimental unless someone has a true micropenis, which is extremely rare. Everything I'm about to share appears in urology literature, but you should never pursue any of it without proper medical guidance. And just to be clear, I don't offer penile lengthening in my practice, but because so many men struggle with this quietly, I did the research for you. Now, there are only two categories of options in the medical world: non-surgical and surgical. Let's start with non-surgical, and the most important one is psychological counseling. There are validated tools that help men understand what normal really is and reduce the anxiety around size. And here's the surprising part. Most men who go through counseling no longer want any other treatment afterward. Not pumps, not surgery, Nothing. It reduces the obsession, the pressure, and the constant comparison. For many men, this is the first and most effective step. Now, let's talk about the three non-surgical options you'll see most often: penile extenders, vacuum erection devices, and penile injections. And right away, let me be very clear. Only one of these has any real evidence for increasing length: penile extenders. Penile extenders are simple traction devices. You place the penis through a base ring. Two adjustable rods apply gentle tension, and a silicone loop holds the glands in place. Over months of consistent use, that mechanical traction slowly encourages lengthening. But here's what the data actually shows. Men who use these devices religiously, several hours per day, every day for months, did gain length. Not huge, not dramatic, but measurable. On average, about 2 centimeters. And that's based on flaccid stretch length, which urologists use because it closely reflects erect length. So yes, traction can work, but it's slow, it requires extreme consistency, and it still comes with risks: numbness, bruising, discomfort, and sometimes no gains at all. Now, the other common device: vacuum erection pumps. These do help with erections, but they do not increase penile length. There's no evidence for long-term size change. And then there's the most dangerous category: penile injections. Different substances have been tried over the years: fillers, oils, fat, synthetics, and many have led to severe complications. I'm talking deformities, scarring, chronic pain, and in some cases, problems that show up decades later. So I do not recommend any form of penile injection for size enhancement. The risks outweigh the benefits by a mile. Now let's quickly touch on surgical options. The most commonly discussed is a suspensory ligament release, where the ligament holding the penis to the pubic bone is cut to allow more visible length. But again, complications are common, satisfaction rates are low, and results are inconsistent. Other surgeries using grafts, tissue flaps, or even rib cartilage have been tried, but the outcomes are poor and rarely well documented. The science simply isn't strong enough to recommend them. Bottom line: no surgical procedure should be done unless it's under a clinical trial at an institution with a proper IRB, the committee that ensures patient safety, ethical standards, and accurate reporting of complications. And that's why, right now, we cannot recommend any surgical procedure for penile lengthening outside of a research setting. The truth? Men can gain a small amount of length, about 2 centimeters, through traction therapy. But beyond that, there's no safe, reliable, proven way to change what you were born with. Let's step back for a moment. After everything we've covered, here's the truth I want every man to walk away with. Most men who worry about length don't actually have a size problem. They have an anxiety problem, one fueled by comparison, misinformation, and unrealistic expectations pushed by online content. And when that anxiety takes over, the temptation is to chase anything that promises a quick fix, even when those fixes are unproven, unsafe, or flat out dangerous. Yes, we do have one non-surgical option with real evidence: traction therapy. And even that requires months of consistency for very small gains. Everything else? Still experimental, still risky, still capable of causing damage that's far worse than what you started with. So here's my challenge to you. Before you do anything to your body, before you buy a device, book a procedure, or trust a random website, pause. Ask yourself, is this coming from real need? Or from fear, comparison, and pressure? And then take the most important step of all. Talk to a professional, a psychologist to help address the anxiety, a reputable urologist to guide you safely. Because your confidence, your body, your future, they deserve clarity, not panic. They deserve protection, not experiments. And they deserve care from someone who actually has your best interests at heart. If you take nothing else from this video, take this. Don't let anxiety push you into irreversible decisions. You're worth slowing down. You're worth doing this the right way. If today's video gave you clarity, reassurance, or even just a little relief. Don't forget to like this video, share it with a friend who needs the truth, and subscribe to the channel. Your engagement helps more men break out of fear, stop comparing themselves to unrealistic standards, and start making safe, informed decisions about their health. This is Dr. Ava, and I'll see you in the next episode.